Hey, this is Shilpa Bhouraskar. I'm a homeopathic medical doctor turned coach, author, mentor, and founder of the world's #1 online academy for professional practitioners. Now, thanks for joining me today. And the topic for today's lecture is all about miasms. The focus of this lecture is to demystify this confusion around use of miasms, what they are, bringing more clarity, and more importantly, the practical application. My course and books on miasms are one of the most popular in my network. And today, the way I'm going to actually help with this topic is answer the key questions some of my Argentum mentoring students have asked me. And in answering these questions, I'll be clarifying a lot of confusion around this topic, right? So let me first get to the first question. This is by Babette, and she starts with a very basic question. What exactly are miasms? Now, the reason she's asking this is because there are so many different types of confusing definitions. She mentioned, can it be initiated by an infectious disease or any infectious disease if the person has not been well since? Is this correct? Then she said, Sora was initiated by some sort of itch or annoyance, or as opposed to an infectious disease. Is this the suppression of it that causes it to be a miasm, or is there some other mechanism? Now, I really like this question because although it's a very basic question, it causes a lot of confusion since the definitions of miasms have changed right since Hahnemannian time, right? So to simplify this process, I'm basically going to classify the miasmatic evolution into 3 distinct phases and types, right? So we first start with Hahnemannian miasmatic definition. Now, according to him, miasms were the fundamental cause of all chronic diseases. And based on his experience of studying chronic diseases for 12 long years, especially those that homeopathy was not able to help with in his practice, he found that eruption of itch was often found in the history of people suffering from chronic, non-venereal chronic diseases. So he concluded that the infective agent of itch was the fundamental cause of these non-venereal chronic diseases. Now, he termed the word soric miasm for this infective agent. Now, in his experience, it was responsible for majority of all the chronic diseases in his time, which were non-venereal, and the rest were caused by the syphilis and the psychotic miasms. So according to him, there were 3 infective agents, and they were responsible for these 3 primary miasms. Sora was due to the infective agent capable of producing itch, which the later homeopaths realized was the scabies itch mite. Syphilis was due to an infective agent that causes syphilis, which we now know as the bacteria Treponema pallidum. And psychosis was due to an infective agent that causes gonorrhea, which we now know as bacteria Neisseria gonorrhea or gonococcus, right? So this was basically what he started off with. But this was just the tip. What happens was these primary infective agents, when they infect, they cause something like a primary infection. If it's let alone and if it's not interfered with, there is no problem. But what he mentioned was they went on to internalize and create what we call a more deeper, developed, latent miasmatic condition. So for him, latent miasm was a type of secondary broad spectrum, internalization of this primary infective agent. Now, what happens is once it internalizes, it creates some innate predispositions and tendencies mentally and physically. Now, again, he was very, very adamant about saying that they will remain latent and dormant for a very, very long time if you leave them alone, right? And If there is some exciting factor or some stressful incident in the individual's life, then they might awaken this latent miasm. So a patient might remain healthy or seemingly healthy for a very long time until much later, when there is some exciting factor or just progressing aging as a part of it could awaken this latent miasm. And basically he was just talking about psoric miasm at his point. So the question now is, there is this primary infection, you leave it alone. If you don't, if you suppress it, if you try to really interfere with it, it can go into this secondary phase much more quicker, secondary active phase. But if you leave it alone, it will internalize and just remain dormant for a long time until some exciting factor will excite it. And then it becomes a secondary active miasm. So there is this primary infection, it goes and becomes latent and remains under the surface, which is a secondary latent miasm. Now, if this latent is awakened by some form of suppression or some exciting factor, then it becomes a secondary active miasm. That's the whole process. Now, this is very critical because this definition stays the same no matter what sort of miasmatic understanding we are looking at, right? But what are those exciting factors that can, reawaken this latent miasm? So the most common is, some form of suppression by conventional medicines, or some sort of an acute disease, or some sort of a trauma, physical or emotional, or some trivial cause, some dietary issues, some lifestyle factors. So whatever we call those exciting factors could sort of awaken this, and then it rouses into activity and becomes this really active miasmatic disease that gives rise to innumerable chronic conditions and pathologies, from superficial to deep organ changes, based on that individual's predisposition, his weaknesses that he's inherited, and other lifestyle conditions. So this is what we call the chronic miasmatic active disease. So this is what is psoric miasm. If it's, through the H infective agent, it could be a psychotic miasm. If it's through the gonococcus bacteria, or it could be a syphilitic miasm if it's initiated by the syphilitic bacteria. And this is important. To resolve this chronic internal miasmatic disease, we cannot use acute in homeopathy. We need anti-miasmatic remedies that work deeply to cover and reverse this entire process, this entire secondary active process that has gone on and created this full spectrum, disease, which could be from head to toe. You need anti-miasmatic remedies to actually reverse it. Now, Hahnemann spoke about just 3 miasms: psora, psychosis, and syphilis. However, some of the contemporary homeopaths expanded this concept to also include other infective agents as causes of chronic diseases based on their experience. So one of them was J.H. Allen. He discovered pseudopsora or tubercular miasm. Now he reckons it's a combination of psora and syphilis. Now Hahnemann also spoke about a combination of miasms. He said sometimes they get, psora is the start, and then somebody has, an infection of syphilis later on. This syphilis can go and combine with psora and form something called a complex miasm. Now, according to J.H. Allen, tubercular bacteria could give rise to a tubercular miasm, which he also said was very similar to pseudopsora, a combination of psora and syphilis. And then there was Margaret Tyler. She's written about other infectious diseases like smallpox, pneumonia, diphtheria, influenza, typhoid. So they could also cause chronic miasmatic diseases. What do you mean by chronic miasmatic disease? Is it doesn't remain as a primary acute infection. It will go internally, become latent, and then if excited, create this big broad spectrum active miasmatic disease. This is a very important phenomena that we have to understand. It has to go in and create this secondary sequel in a way. So that's the whole process. Now, Compton Burnett was another homeopath, and he specifically mentioned about vaccinosis or the vaccination miasm. Now, there was just smallpox vaccine in his time, and today's homeopaths have documented clinical experiences to support the fact that almost any infective agent and any vaccine can create a chronic miasmatic condition in susceptible individuals. And hence I call them contemporary Hahnemannian miasms, because they follow the same definition as Hahnemann mentioned for those primary three miasms. Now, further on, homeopaths have also found that miasmatic chronic diseases are not just restricted to infective agents. There are non-infective agents that can cause miasmatic diseases. The most popular, as we all know, is cancer miasm. Now, Burnett has clinical cases documenting the use of many cancer nosodes. Now, Dr. Donald Fubister has done a lot of work on cancer miasm, and he studied the role of carcinosinum, which is documented in his book, The Carcinosin Drug Picture. And this is based on his experience of women who had cancer or breast cancer. They were pregnant and then they had children. So he documented the symptoms of these children born to mothers who had breast cancer. And what he found was the whole syndrome of cancer miasm in these children, right? So, and how carcinosinum was able to help and reverse that. So it's very exciting. And today, with the emerging role of epigenetics, non-communicable chronic diseases like diabetes and heart disease and cancer and autoimmune and neurodegenerative conditions support this theory. So I call these contemporary Hahnemannian miasmatic diseases, if they are by an infective agent, or you can even call them states, because if they are by non-infective agents. And I've documented 10 such states or 10 such fundamental causes in contemporary practices that could give rise to so-called contemporary Hahnemannian miasms. So hope that helps you understand what Hahnemannian miasms are all about. In the next lecture, I'll talk about the Kenton miasmatic definition.